Hello, everyone, and welcome to another episode of the podcast. Here we explore everything that helps dentists build extraordinary careers, not only clinical dentistry, but also communication, personal branding, leadership, business, and the skills that make a real difference in today's world. My guest today is Dr. Naheed Mohamed, a periodontist, implant surgeon, international lecturer, and educator known for his expertise in microsurgery, soft tissue grafting, and advanced bone regeneration. Nahid, thank you very much for joining me. It's a real pleasure to have you here.
Thank you. It's a pleasure to be here. I didn't know people, all the way in Poland even knew who I was. So it's nice to be here.
We Poland is not that far as you
Yeah,
think
yeah.
because we have internet. So
That's
because
true.
we have
That's true.
internet and you are online,
Yeah.
it means that you are very, very, very visible also to us. And I can tell you that uh, the mm, the level of dentistry in Poland is pretty good, I would say. Um, and hopefully, we will also discuss some very interesting uh, perspective on dentistry and photography today. So, are you ready?
Yes, let's go.
So, Nahid, let's start simple, right? Let's say people like me, other dentists, when I look at someone like you who already has a very who built a very strong professional position, we obviously see only the end results, right? We see your clinical work where you post on social media. We might see your lectures during conferences.
Yeah.
uh, we see the end result of your personal brand you've been building for all over these years. But obviously, we rarely hear something about decisions which were made along the line, some challenges that you were facing along the line, or maybe some sort of turning points that made all of this possible.
Yeah.
So, my first question is, when you look back at your, let's say, professional journey, which decisions and kind of experiences had the greatest influence on the person, on the clinician you are today?
I mean, there's a lot of influences. I guess we know there's a lot of doctors and dentists and surgeons that have influenced me throughout my career. Originally I remember back when I was in residency, at that time we had big names like Maurice Salama and Michael Picos. Oh, you know what? I'm just getting an emergency call. Just can I just answer this? Give me 1 second.
Sure, absolutely. Take your
Hello?
time.
Hi. I'm
It might
home.
it might be a patient.
Okay, I'm just doing a podcast, so I'm just busy between 12 and 1, but it's fine. He can come. There's someone who can answer the door and give him the keys. Okay, but I don't think he's gonna be here before 1. Okay, that's fine then. He can text me. Okay, thank you. Perfect.
Was this
Sorry.
a patient of yours?
No, you know what? They're supposed to come pick up my car. There's something wrong with it, so he's supposed to send someone. So he's just
Yeah.
letting me know that they're gonna be on their way.
All right. So
This
carry
is
on.
life, This is life, Life
This
jumps
is
in the
life.
middle
This
of
is
our
what happens all
yeah,
the time.
yeah. So
There's nothing you
like
can do about it.
let
So
me just
go ahead.
close this door for a second.
Yeah, sure.
Okay, so like I was saying,
Yeah.
influences. So there was, initially, I had my surgical influences. I was saying people like Maurice Salama, Michael Picos.
Mm-hmm.
Uh, these were usually like very young when I started in my residency and started to do surgery, and uh, and then it sort of evolved. Then, early in my career, I started noticing the dentistry and the surgery coming out of Spain and Portugal. and Russia too, and in Europe in general, and it was different. It was more clean. The photography was really good. Like initially, like I think really good surgical photography came from guys in Europe, Spain and Portugal and
Mm,
Russia. Now you see a lot of really, like from me in North America, these names were unknown, but really, really amazing surgery and really good skills. And then on top of that, the photography was really good, So I started then seeing, people like, Ramon Meda, there's guys in Portugal. Now even now there's people that we don't really know them there, but they're coming up. So, and then when I started, you know, seeing the work, and you get as you see it, it sort of builds this fire, like, oh, you know what, this could be so much more. And I think from the surgery point, when we do surgery, we're not we don't, it's not like cosmetic dentistry. It's not originally it wasn't aesthetic, but then through photography it could be aesthetic. It almost gives like the surgery. Like for me as a surgeon, I can see a case and it's photographed really well. And I'm like, oh, that's beautiful. But someone like Rafael will look at it and was like, oh, what is that? I can't look at that. And so it made me transition into now saying, I as a surgeon am also like an artist. Through photography, it created this new passion. And then I remember my first photography course. Like we learned basic dental photography in school with just the basic ring flash. And then once I started to see all this come out, I don't know if they give these courses, but there are two guys from Venezuela. I forget their names right now, but they used to have this photography course, and they went all around the world. Uh, and so they had come to Toronto at some point. So I'd taken the course, and that's when I got into learning about, the light and how the flash and the photo bouncers and diffusers really changed the way the photo looked. And then
so,
through that, yeah.
all right. So, what was first, photography or surgery? So,
No, surgery first. So surgery was first. Okay. And
and then
then
you noticed, then
Then
you
I
know,
know, yeah. Then I noticed that I started to see these
yeah,
surgeons show cases with photography and like I've never seen before.
oh yeah,
Because if you look at the traditional, ring flash photograph, it's very like plain. The color doesn't come up. It's the lighting is not good. Like if you see the two pictures, it's the same surgery. It looks so much nicer when you have a
absolutely.
good setup. So it kind of I started to say, hey, you know what? In Canada, dentistry is a little bit different. As a specialist, we are referral based. So we don't go to different clinics, or I don't do any restorative work. I work in my clinic, and other dentists will refer their patients to come see me for for surgical reasons. And then we send it back and they complete the case. So because of that, I thought, okay, you know what, if I can showcase what I do and make it look much nicer and cleaner, it will then put me in a different category. And through that, I decided that, okay, you know what, this is only me personally. I enjoyed it because it just made you feel good that, oh, the surgery looks so much nicer and cleaner. But then it has potential for marketing, for building your practice, building your brand, building your name, and so on. And so that's how my journey kind of began. So it was like through a personal passion, just to like and enjoy having a good photograph and a good case. And then that same case can be used both for marketing and building my brand. So it's almost like dual. For me personally, I get fulfillment, and for the practice as well.
It's really interesting what you said because
Yeah.
you've mentioned that really the photography for you was kind of a turning point in your career because you were an ordinary surgeon to the moment you've noticed on the base of nice photographs that people do something really really nice and it can really look wonderful and you can do
Yeah.
actually the same.
Yeah. And now with the internet and social media,
Yeah.
we have this saying where, like, I tell my staff that, what, if we did an amazing case, it doesn't exist unless it was photographed, because it's not captured. Then it's just in our memory, in our mind, but if we photograph it, it's like we have that surgery now immortalized. It's there, everyone can see it, you know but if it's not done, not photographed, nobody knows.
So how many years do you do professional dental photography to this point?
I think I probably, what, Instagram, once it came, that kind of boosted my interest and pushed it more. I think it's been maybe 2017, probably, I think.
Hmm. Around 10
Something like
years.
that. Yeah, around 10 years, yeah. And now, now what I find is, now I'm starting to learn, but I'm noticing there's a shift into not photography, but also videography. So it's a combination of both.
Exactly. That's also kind of interesting. I think we will get back to videography
Yeah.
uh, along the line. But tell me, uh, do you consider yourself as a successful dentist? What does actually success mean personally to you? And does this word change this its definition in time?
Yeah, I mean, success, it depends on how you look at it. For me, success may mean different things to and then someone else. Like, for example, someone else may say, well, you have a busy practice, your name is well known, you're getting lots of referrals, you're successful. But that, for me, success, I think it's a journey. And I think
Mm,
as you go along, it shifts, it changes. For me now, I think I would define success as probably creating something that I'm happy with, that I say, what, this is, for example, a good surgery, a good procedure, good result, where I personally am happy. Sometimes a patient is happy, but I feel like I could have done better. And then also, I think, to have more freedom, because I find now, as I'm successful in the sense of work and I'm busy, time is what I don't have. And so now my new definition of success is to be at a point where I have more time. So that's the new, so I can the practice still run and be successful and be busy, and still give me a little bit more freedom of time to then maybe say, what, like, do things that, like, for example, when I was an associate or I was working, I didn't have my practice, I had more free time. So I would take more CE courses, I would go learn something. Now I find that time to expand and learn and go to the next level is restricted because of the amount of time I have. So it's almost like you have a business that has to be run, but you can't, spread your wings because you're trapped a little bit.
totally agree. Time
Yeah.
is so much
Yeah.
valuable for us as dentists. We are very, very busy
Yeah.
nowadays, uh, because it's not only having
Yeah.
a practice, but it's also Instagram, adapting to the modern life, to everything that changed in front of our eyes, AI, all
Yeah.
that kind of
Yeah.
stuff,
Yeah.
and new equipment. Well, that's kind of
And it
difficult.
never ends. The problem
It
is,
never
with
ends, exactly.
technology, the learning journey never ends. I'm actually now,
Exactly.
I signed up for, like, it's a 6-week boot camp. It's in the evenings. It's to
Mhm,
learn how to code in AI, with
mhm.
AI coding. So,
Oh, oh.
it's for beginners, but I want to learn because it seems like the trend is going that way, and it's
Yeah,
totally
totally.
foreign for me. So at least
Absolutely.
if I dip my foot in that pool and know a little bit, who knows where it can take me.
Do you
So the
think you will use AI to have a better social media, for example?
maybe, like, I started using AI to create a lot of marketing material for our office. Like, I
Oh,
will, I think it has a good it sets up and creates something very fast and quick. You have to still give it, like, some instruction. Like, I give it the text and the content and the photographs, but it just makes something so nice. and it will make it into a PDF form. It'll have hyperlinks to it. So it does make things a lot simpler and easier. I don't have to now ask someone who's in marketing to do it. I literally prompt it. I walk away 5 minutes, it's ready.
And what's really interesting that it's evolving very, very quickly in front of our eyes. I mean,
Yeah,
GPT, uh,
yeah,
when I discovered it like 2 years ago, it
yeah,
wasn't that good as it is today. It can do such a lot of work for us, dentists, general entrepreneurs,
yeah,
team leaders, uh, lecturers. You know,
yeah.
it does all the stuff for us.
It can, yeah.
It's absolutely wonderful tool. I mean, it and
You know,
it's like that cheap. Everyone can
it's yeah.
afford it. I mean, it's absolutely a wonderful tool in our toolbox.
Yeah,
But
it's like having the entire world's information, in a prompt. You just ask a question, it can answer.
yeah,
I think it'll be good for even just in general for the office to help create systems and like
mhm,
software and little things to kind of run and make things more efficient.
mhm,
I think probably once the AI gets a little bit better, you can prompt and create videos and other content, So I think like you said, it's growing so fast, it's hard to keep up. So before I get lost and left behind, that's why I'm taking the course, because I want to at least know something before it just passes me.
Nahid, you've mentioned you feel a little bit of an artist in
Yes.
yourself. Is this the reason you've choose this specialty, which is periodontology and implant surgery, because you do believe this might be like an artistry or something, or was there other reasons?
No, so I didn't choose periodontology because of artistry. I've always had, artistic inclinations, but
Mhm,
I chose surgery because I enjoyed it. But
mhm,
then I think photography transitioned me to kind of feel more like an artist, because now, you know, it it's you can showcase your work. So, like an artist who paints a painting or makes a sculpture, for example, reconstructing a ridge and growing it is my sculpture. Building soft tissue,
mhm.
is my work. But if I can do it in a way that is clean and beautiful, where probably surgeons will find it beautiful, not everybody, but you know the dental community will find it beautiful. It gave me a new passion, and it I find it drives me to do better, because I noticed that sometimes if we'll do a procedure and it turns out really well and we were able to photograph it really nicely, it just brings joy. Like, okay, this looks good. I have something really nice here.
You mean you've said something which really leads me perfectly to the next question, because you've mentioned that what you post on
Yeah,
your social media might attract dentists, which totally agree.
yeah,
I mean, all of us know exactly what's behind the scenes, what it takes to do a good, proper surgery. Some of us maybe know how to photograph it very well, that it's not that easy. And we treat it as a very, very valuable stuff and educational content. But I do think that for an ordinary people who are our patients, it's not the same. They perceive these posts a little bit more extreme. Do you have
yeah.
the same perception?
Yeah, yeah. So we usually, yeah, like if I have my wife or my daughter would look at it, they're like, "Oh, what is that? Please change the screen." So it is for someone who has to understand it to get it. It's like, I guess, even it's like with art, right? If someone looks at a painting, if
Yeah.
you don't understand the technique or the background or art in general, you will look at a painting of abstract art and think, what did he do? Just take a bucket and splash it on the canvas? So I think it has to do with that. So I think you do have to understand it. I think so. This is funny you said this. So we were looking at our, someone to help us with social media. And one of the things he said is, your page is very scary. He's like, most of it is covered. They shade the screen. So he's like, do you ever think maybe to give other pictures that are, maybe the patients will like? I'm like, yeah, we can do the before and the final result. We don't have to show the surgery. But I'm like, the surgery is what I do. But he's like, yeah, but maybe we keep that out, maybe to your own personal page. So I guess, because the problem is, I tell people, like, I talk to my restorative doctors, and I tell these to the patients who come to see me, is that, I build the foundation, I build everything that makes it look good, but the one that does the last, who scores the winning goal, is the restorative dentist, who gets to put the teeth in at the end, and take all the credit.
Totally
But uh,
agree.
but his work is based on my foundation, so
Yes, totally agree. Totally agree. So Naid,
yeah,
is your Instagram
yeah.
basically for your patients or for other dentists or maybe both?
So
Because
I
from my
think,
perspective, I do feel like more for dentists maybe.
yeah, so it was built because, remember, I mentioned that here we get our referrals from dentists, not direct
Yes,
to patient. So it was
exactly.
built initially for dentists, and it
Hmm.
still is geared towards dentists.
Hmm.
I think, an average patient would look at that and be like, "Oh, no, please, I don't want to have this procedure." You know, so we're now gonna build a new page for the office, and that one will have more the it'll be geared towards patients, which will have just before and afters, nothing too gruesome, more just talking about what is possible rather than showing how it's done.
Okay, so the profile that you have
Yeah.
also functions as a professional portfolio where everyone can see your nice work.
Yeah, so that's the dual purpose of it. They can see that, oh, you know what, I've seen his
Exactly.
work. If my marketing person goes into, let's say, a new office and says, oh, this is us, this is what we do. Would you like to work with us? If you want to see some of the doctor's work, it's there on Instagram. You can easily access it. Anyone can see it. So they can then get a taste of what I do. They get to see some cases, and they get an idea of, who I am and the work I do. And so, like that, it serves as a purpose to help
Yeah,
generate
so
referrals.
Instagram and photography has a great rule in attracting other dentists to refer patients.
Yes, yeah,
So they
definitely,
become
a
your
hundred
client,
percent.
actually,
Yeah.
right? They become
hmm
your client.
So 100%. People don't
Mhm.
realize the power of social media. Like I
Yeah.
get, so because of the social media, I get referrals, people who will come from 3, 4 hours away because they've had
Mhm.
some complications, and the dentist says, you know what, there is one guy, you can, it's a little bit far, but you can get to him. Maybe he can fix it. And people will come from far. So it has, there's a small portion of my practice where I do a lot of revision surgery. And
Mhm.
so, and people are willing to drive to fix it. So, and this I think is from Instagram, because they
Okay,
wouldn't have
so
known, because I've never met them, they don't know me, but the only
exactly,
thing that's out there is Instagram.
Instagram does the thing. So, how many years did it take for you to become a top-notch periodontist who is followed by thousands of other dentists, and they consider sending you patient?
Yeah, I'm still trying to get there, but I'm not there.
Oh,
I would say it probably took, like, because I find you have to practice for at least 10 years. I
um,
think because when you come out of school, you're still
mhm,
learning a lot. Even
mhm,
me till today, I'm still learning. I don't see myself as,
mhm,
at my peak. I feel like there's a lot more to learn.
mhm,
But I think I would say, like, an average dentist, it'd be or anyone who's graduate 10 years, because first you graduate, you see the real world. Dentistry in the real world in a clinic with patients is different than, in a school. One thing is, a lot of cases sometimes you can't do everything that you like to do. Like, let's say it's a very complex case that it needs interdisciplinary treatment. They may not choose to go through everything. They might say, like, a lot of cases sometimes would be much better if they were considering orthodontic treatment or
mhm.
doing a lot more prosthetic work, but they're limited. So in those cases, you have to kind of work with what you have and what the patient's going to do. So, and then some case, so I think out of school, you learn what reality is, and then you also need time to own your skills. Like I find as I've done all of this, no matter how much digital technology comes out, how much technology changes, materials change, it's all based on those basics, the foundational skills. If you don't have good foundational skills, then you can't excel even with technology. It's like cosmetic dentistry. If you still cannot prep a tooth properly and cleanly, you'll never be a good cosmetic dentist. No matter how AI comes or robot comes or the materials they use, you still need that basic foundation.
It's I'm really happy you've mentioned that, because what I can tell you is that a lot of my students, they think that they might skip the analog part of the treatment
Yeah, no, no,
and
no, no.
just
Yeah.
go to digital, and they
Y-
think that without proper understanding of the essentials of,
Yeah.
for example, in my case, prosthetic dentistry, they can go fully
Yeah.
digital, and then they will handle everything, because obviously this looks pretty damn good.
Yeah.
It looks pretty nice, but without understanding, are can they become a proper specialist?
Yeah.
I think not, as
No,
you've mentioned,
same
because
thing
you
with
have a
implants.
lot of
Yeah.
experience, right? Same thing. Yeah, exactly.
If you,
You can have the 3D navigation, but if your hand is not skilled enough, if you
you
haven't
can,
done thousands of implants,
yeah,
then how
then
can you
you
become
can't. Yeah.
a professional? Right? I mean,
Yeah, because then you're putting all your trust in the digital technology,
yeah,
and we all
yeah.
know if you've done a lot of it, there's errors. Sometimes it doesn't come out accurate. I've done a lot of cases, and it's digitally guided, and I'll do the first drill, and then I always double check because I don't trust the guides, and it's off, and I'm like, you know what, this doesn't look good, and then I just freehand it, and
Uh,
so
for
if
example, you cannot 100% trust
yeah,
to CBD.
yeah,
It's not a perfect perfect transition between oral cavity and the radiograph. There
yeah.
is some might be some uh, problems between one and
Yeah,
another. So
like if there is any deviation or errors, it's
yeah.
gonna get compounded, and by the time you get the guide in the case, it's gonna be off. So if you don't know how to do it, for example, with implants freehand, then you're lost. So and it's like, would you let go sit in a car that's, if you don't know how to drive, would you go sit
Mhm,
in a car and
mhm,
just let the
mhm.
the robot or the computer drive you everywhere? What if something happens and it malfunctions? Now you're sitting there, you can't drive the car. So it's the same thing. But I think also when you do the basics and you learn the foundation, you understand the digital better, you
Mhm.
know, and you can understand where it can make errors and you can understand where it's really good. So for me, when people say, "Oh, are you a digital dentist?" I'm like, I'm still, I would say, I'm analog where, and then I use digital where it can enhance my analog.
Mhm.
So where it can help me, I will use it, but I'm not totally dependent on it. And I think that's right now where someone can become great, you know?
All right. So, what kind of digital instruments do you use?
Well, usually we have, digital, I guess we use intraoral scanners, CBCT. Uh, Sometimes I don't have it, but the lab will have it. Sometimes if we're doing larger cosmetic cases, we'll use a facial scanner, and put it all together for planning. But from a surgical point, really,
Mhm,
it's the digital files are just mainly intraoral
mhm.
scans and CBCT, and then we can use 3D printing and planning like that. We do like through that's I guess where
Yeah.
I get my digital acquisition. But then with that data, sometimes we will create guides, like we'll create surgical guides to make osteotomies, to harvest bone blocks.
Mhm.
Uh, Sometimes I'll make a surgical guide as a reference point Like we had a case where it was a malpositioned teeth, and she had had an accident, and the front tooth had come out, and she didn't want to consider orthodontic treatment to straighten everything. So when we looked at the space, we're like, well, your tooth doesn't fit in this space. It's too narrow. So you must have had it buccally positioned. Do you know? And then we asked her, like, do you know what it looked like so we can match what you have and maybe give you something that you had before? And so she found old photographs, and through the old photographs, my lab tech basically digitally did a wax up. We then used that and kind of overlaid it over a picture in her smile. We showed it to her and said, "This is what we think your tooth looked like." And she's like, "Yeah, yeah, that's what it looked like." And so, based on that, we then created a guided plan. But what I did was, because I don't trust guides fully, I had a guide made for the implant placement. But because this tooth was shifted facially, when I look at I'm doing the surgery, it just feels like, oh, the implant's too buccal. So what we did was I had them make uh, just a 3D printed tooth that sat with a jig so that I could just keep putting the tooth in place and use the tooth as a surgical reference, so that I'm
Mhm.
not totally dependent only on the guide. Because with the guide, I'm drilling, but I'm blind. I don't see the tooth. So things like that, you can use digital planning and 3D printing to create reference points so that you have something to follow up, even if you are doing it, let's say, freehand.
It's great to have this kind of technology on
Yeah.
our side, but I do believe that we can just mix the technology, mix analog and
Yeah.
mix digital for our favor, like to have the best possible results. All right, let's change the topic a little bit. You've mentioned like your most of the patients you have are referral patients, right?
Yeah. Hmm.
Okay, but let's imagine that a referral patient, maybe it's not referral, it's a simple case. It's a simple case, a case of a patient who comes to you for a consultation. And you know what? From my perspective, I can tell you that people, patients, they do notice quite quickly when they have some sort of misalignment of teeth, when they
Hmm.
have their teeth a little bit discolored, when there are some minor
Yeah.
defects in their frontal
Front
dentition.
tooth.
But
Yeah.
I do think they do not consider recessions, thin biotype, lack of volume of soft
Yeah.
tissues as a problem.
Hmm.
Is it the same that you feel? Because
Yeah. So
this is this is my perspective. What's
So
yours?
usually, yeah, like for example, let's talk about recession. So
Yeah.
recession, unless they have a high smile line and the recession shows, and you can see, but for them it's a cosmetic thing, because now with the recession there's asymmetry in the smile. So
Hmm.
now it becomes, oh, it's a cosmetic issue they want to fix. So those ones usually they see the issue. But if it's on a posterior tooth, a lot of times they won't see it, or they will not know, and their dentist or their hygienist will say, oh, we noticed this, you need to go see it. But they come based on the fact that they feel like, I think the dentist will say, you have to get this treated or it's going to get worse, you may lose your tooth. So it's out of fear of losing the tooth, not really recognizing the recession and attachment loss. It's like periodontal disease. If you have, let's say, moderate periodontal disease, there's no symptoms, you feel fine, and then they come in and we tell them, oh, you need to do all this and this and this, and they're like, well, I didn't have any problems. Why do I have to do the treatment? I feel fine, nothing hurts, it's good. So we have our challenges. This is where I use a little bit of, we explain what the risks are. We use, like, I use a lot of drawings in my sort of uh consultations, because I find patients can understand things visually. And so what we do is, sometimes I'll take a picture of the x-ray, or I'll have the x-ray on the iPad, and I'll draw out, I'll make them understand first what it is, what they're looking at, where the teeth is, where the bone is. I'll say, this is what normal health is, and now this is where you are. And I explained that a lot of times there's no symptoms, and when you get symptoms, it's usually too late or too far gone. And so that's why you're not feeling it. And I use blood pressure an example. I say a lot of times, sometimes when your blood pressure is high, but it's not, let's say, through the roof that you have to go to the hospital, you feel normal. But you go and your doctor says your blood pressure is high, you need medication. So I explain that periodontitis is like blood pressure. It sort of flies under the radar. It doesn't have any symptoms until things get serious. So say we want to make sure you don't get to that point where you have to go to the hospital or you have to lose a tooth. And I find drawing makes them understand, because a lot of times they'll leave and they'll be like, you know what, the way you explained it, I really understand. I get it now. My dentist was saying that to come to see you, and I didn't really know, but you
Mhm.
explained it really well. But from the drawing, I just got it. So it helps to make people understand. And this is, I guess, with the iPad and the drawing, the Apple Pencil, and it makes things easier. So that's another use of digital technology. Because before I would have
Exactly.
a piece of paper and I would draw out.
Yeah. Yeah.
But now
It
I
helps.
can
Yeah.
I can draw on the actual, like on the photograph of their teeth or on the X-ray. I can, draw on this so they can see exactly where. So it's a little bit easier. But the foundation or the basic is just I'm basically drawing for them to understand.
Do you also like use some sort of photographs before and afters to show people
Yeah,
uh,
so
what was the problem and how the problem was
yeah,
solved?
so we have an office iPad that we use for the consultation. So in that iPad, in the photograph folder, there's before and afters of different types of treatment. We have implants, we have sometimes I'll show, like, there's pictures of the parts of the implant so they can see, because a lot of times people, when you say implant, they think it's the whole thing with the tooth. And I say, no, no, it comes in components. I said, there's the fixture that goes into the bone, there's an abutment, and then the tooth, which is the crown. So a lot of times they're like, oh, I thought the implant was the whole thing. Like, I just come in and I leave with the tooth. I'm like, you can leave with the tooth sometimes, but this is what it is exactly. So it helps a lot with regards to the consultations, and they see before and after. So when they see, they're like, oh, okay, that's what I have. That looks like mine, but oh, it looks much better now. So it helps with convincing them that what's possible. uh, it shows them, especially even with anterior implants. We will show cases where we try to explain why we need to build the contour, because they're like, well, why do you need to do a tissue graft? And they don't get it till the final restoration is in place and you have a long tooth. And I'll say,
Mhm.
because they didn't build up the contour, so they had to make the tooth kind of fit with it. So I said, by building the contour, like, for example, I use the term ridge augmentation a lot, because I tell people that when we do ridge augmentation, we're building the volume of the ridge to get a more aesthetic, natural looking result. And ridge augmentation is not just bone. We're building bone, but we're also building tissue. Now, for posterior sides, that could be tissue volume as well as keratinized tissue. For anterior sides, it's most of the time it is a lot of volume to build to get something looking natural. So with these cases, like I said, we do a lot of revision cases. So we have cases where someone will come in, they'll have an anterior implant crown with uh, pink porcelain and the threads of the implant exposed. So I have to explain to them, to remove this and reconstruct, we got to rebuild the ridge, and the ridge involves both bone and soft tissue to natural contours so that you can have a final result that looks natural. And so when they see this visually, it's easy for them to understand.
So, as I hear, you're actually in the moment of your career where you don't really need to build a kind of connection with the patient, a trust, because the trust is something that is obviously very important to do this complex treatment planning, this
Yeah,
invasive procedures, cosmetic dentistry, orthodontic, and also what you do.
yeah.
Because as you mentioned, you have a lot of referral patients, and then actually they need to trust you. There is no other option for
So
them.
yeah, so
But
the
if
good
there's
thing, like,
someone who will come to you for consultation, how would you build trust? What kind of methods do you have to
okay,
build
so
trust?
number one is, if someone is referred by their doctor, the doctor already has put in a word to say this guy's amazing, this guy's good, he's the one to fix. So they come in with that in mind. So those patients, they already know that, okay, I'm here, this is an expert, I trust him because my dentist said so.
Yeah.
Okay. Then there's other people who just happen to come because they either want a second opinion. Like, I had a patient actually 2 weeks ago. She saw the oral surgeon. It was two anterior teeth. It was the 2-1 and 2-2. She saw him. He made the plan. She had the surgery booked. And then she actually went in for a colonoscopy. And during
Mhm.
her colonoscopy, the nurse there, I guess they were talking, and the nurse said, "Look at my front tooth." This, and then she looked at it and she's like, "You want to know who my doctor is? Go see my doctor." So while she's getting a colonoscopy, the nurse says, "No, no, you go see my doctor." So then she came, so then she made the appointment and she's like, she told my front desk, I don't know why I'm here. I already had the surgery booked somewhere else. Maybe I made a mistake. And our receptionist, just see him. If you don't like it and you're not happy, you can go back to your original doctor and complete the surgery.
Mhm.
So she came in, we did an intraoral scan. I explained the process. I showed her the different steps and everything. And then I told her that we're going to get the lab to do a digital wax up to see what's possible and where we're planning to go. And I think through just hearing me talk about the steps and the phases and the digital planning of showing her a wax up and a video so she can see where we're planning to go, her mind was changed. And she left like, you know what? I'm so glad I came here. They were right. She's like, just from hearing you talk and the way you explain the steps and each thing, I know that you know what you're doing. So I don't really need to show them. I think when you know what you're doing, the confidence in that you are, it comes naturally where the patient can, it's something they can sense. If someone, if you go to a doctor and they're kind of fumbling around, they give you a few different answers, they're like, well, we could do this, I don't know, we could do this. The patient inherently can sense that, okay, he's not sure, maybe he hasn't done many of these cases, you know whereas when, like, I see a case, I already know that this case, anterior cases, I already know that this is what we do. We do this, and this. We're most likely going to do bone soft tissue grafting, provisionalization. I explained that we have to do provisionals before we go to the final. Everything is step by step. I phase it out. She just knows that, okay, this guy, I can tell he knows what he's doing. He's confident. He explained everything. I understand what he's doing. I think this is the person to see.
Exactly. I think the key point here is the word confidence, which
Confidence, yeah.
obviously comes after many, many
Time,
years
yeah.
of hard working and experience that you gain during this time. You cannot
Yeah.
fake confidence,
You
you
can't
know?
fake it. Yeah, you have to know what you're doing, and then it just comes naturally.
Exactly.
So,
Exactly. Wonderful. All right. So let's talk about clinical photography now. Naheed, so the uh, tell me exactly
what I
how do
use?
you do a nice clean photographs that they look as
Okay.
they look, and what kind of gear do you use?
Okay, so let's talk about what I do in the clinic first, and then we'll
Yes.
talk about the gear. So
Yeah.
I'm very uh, picky with how I have my surgical site. Whether
Mm-hmm.
I'm taking photographs or not, I like my surgical site clean. So my
Mm-hmm.
assistants know that I go through a lot more gauze than probably the average surgeon, because even if there's blood that clots on the teeth near I'm working, I'm like, wipe it off. I don't, it looks messy, it looks dirty, clean it. If there's blood in the site, this section. Now, before we take a photograph, I
Mm-hmm.
usually will have, I'll have one retract. So I take my own photographs. Okay, because I've tried to train people, but they just don't get the shot that I want, and we end up wasting time taking so many.
Totally
Now,
agree.
so now I take them. I get my assistant. So what we'll do is we'll retract the site, because this is a surgical site. So we have to retract the flap, retract the cheek. I work with two assistants. So
Mm-hmm.
sometimes we get the second one to pull the cheek a little bit. I get the camera ready. They wipe and clean the site, and then basically everything is clean, suction, and gauze, and then it's like timing. I'm like, okay, clean, suction, wipe. Okay, move the gauze, and then I snap the picture. And then if there's saliva or blood, I'm like, oh, I got to take it again. Wipe that blood. Wipe that blood. So it is kind of, you need like a lot of work to prep the site, and then it's timing. You got to get it like in that second, or else the blood will cover the area. You know.
Exactly. Right.
And so you'll see like all these heads there and timing, like keep the gauze, suction, suction. Okay, right. I'm ready with the camera. Move the
Boom.
suction, and then boom, 1 second. So that's how we take the pictures. Now the gear that I use, now I'm using a Canon R5. Okay,
Mm-hmm.
I've gone to mirrorless. I like the image. I
Mm-hmm.
used to use a 70 and 80D Canon, but then I switched to the R5, a mirrorless one, and I love it. It takes great pictures. The I use obviously a 100 millimeter macro lens
Mm-hmm.
because they're surgical pictures. And then the most important thing, I think, is not really the the camera body, but the most important thing is the lighting and the flash system. This is,
Exactly.
I think, with a cheaper camera body, you can get an amazing picture if you have good flash system. So I use the Canon dual flash system,
Mhm.
but I cover it with bouncers like or diffusers. Right now, I don't know. Are you familiar with these guys from London called Focus?
Nope, not at all.
Okay, so
I use
there's
I
a
use I use fixed light. I use
yeah,
fixed light.
I have fixed light, but I realized for surgery it's too big. They're really
I
big. Yeah.
Yeah, yeah, it's big and it can be easily covered with blood, probably.
Yeah, yeah. So it's good for the before and afters, but for this I use so it's these little diffusers. Let me see if I can get. Oh, I have. So
So
basically, they're it's so I used to
let's
use
see.
just so
Mhm,
originally I used to use the photo bouncers that just kind of reflect and bounce the light, so you get a softer
mhm,
light.
mhm,
Then I switched to these it's called Focus Bounce is the people that do it. They run a photography course, but
mhm.
basically it's a diffuser sheet that goes over the flash. It's almost like you've seen some people will take paper and they'll cover the flash with the paper.
Like that?
Kind of like
Sounds
that, but it
about
wraps
right,
around. It's
yeah,
actually like a
yeah.
rectangle. It wraps
Oh,
around the
it
entire
really wrap
flash.
around. All right, I know
It covers the
what you mean. Yeah.
yeah. Like and then I have a flash cap to it that I use sometimes because the flash cap is just easier for the posterior because you can get closer.
All
Flash
right.
cap, I don't know if you're familiar with it. It's like a diffuser for a ring flash.
All right. All right. All right. Because fixed light also has an option to diffuse the ring light as well, but it's
Yeah,
much better than that.
yeah.
And you don't
So
want that form factor, right?
yeah.
To have
Oh,
during
this is
surgery.
it. Yeah, these are the guys, Focus Bounce. So you see, they have a nice setup and it's not that expensive,
Oh,
where they'll give you like all the retractors, mirrors, you'll get
I need
the
to check them
flash
out.
timers. Yeah, they're really good. And he does a lot of like they take really nice pictures. So
Yeah.
we did a course with them in
Mm,
Toronto, and but these bouncers are the ones I use, or these
mm-hmm,
flash diffusers.
mm-hmm.
So, but yeah, so this is what I'm using right now as my setup, and it's working. It's easy, and yeah, so it makes it like usually for me, I need something that has a small footprint, because I need to pick it up, move it, take it in different angles. So it's much easier than using like, we have the big the soft boxes as well in the office, but we don't use them only for like portrait photography at the end. But this is
All right.
usually for my main surgical photography.
Okay, but technically, the whole environment
Yeah.
of taking pictures intra in during
Yeah.
the
The
procedure,
surgery.
the surgery, it's like kind of challenging because of the aseptic working factor. And how do you
It
handle
is,
that?
yeah. So it is challenging. So usually there's two things I do. I
Yeah.
keep changing my gloves, which waste a lot of gloves, or sometimes we'll put a plastic, like a bag over the
Hmm.
body so that I can just press on that. But I
The
find with the
whole body,
plastic,
or just
just the body, just where I grab it.
oh,
I
all
don't
right.
cover the bouncer, the diffuser, just the body where I have to press the button.
Hmm.
And we put a barrier tape on because I do a manual focus. So I
Oh
put a
yeah.
barrier tape so I can manually focus, and then I take it
Exactly,
like that.
because if you want to cover the lens with anything, you shouldn't touch the lens itself. You should only
No, no,
use.
yeah, we don't touch the lens. So the lens is open, and the like even technically the diffusers, if something were to splatter, they could hit the diffusers. But usually when there's nothing really bleeding, if there's blood, then I'm gonna get the site prepped and ready for the photograph first. So
It's kind of interesting thing because we, for example, me and Rafael, we've reached the Nikon
yeah,
and asked them how can we do a proper disinfection of our equipment used in dentistry. And
yeah,
actually, there was no reply at all. They
yeah.
don't want to do any kind of statements here. They just avoid the answering, because we know that it's a kind of delicate equipment, very prone to be damaged. For
Yeah,
example, if you use the wipes which are soaked with
it
alcohol, they are not
it's
very good for rubber covering for sure.
no, no, it'll damage it, it'll wear it out. Yeah, like sometimes I have to. because I use like a glove and I have to wipe the buttons and stuff, but I take just alcohol on
Mhm.
a little gauze and Q-tip and I sit there slowly and wipe it. But I try not to do once or twice is okay, but if you're doing that a couple of times a day, it's gonna wear it away and it's gonna damage it. So the new gloves or the plastic bag is like the clear bag is what we use is actually we have this bag that we use as a seat cover. It's
Yeah.
clear, so it's
Mhm.
perfect. It just fits around the camera body. We tighten. I use that.
So I can just imagine that it takes probably double of a time when you do
Yeah,
surgery
like
and photography, right? But still,
yeah,
I do think that this is a kind of investment. Is that clear?
yeah. So usually, like, if I'm doing a big case, I will allot a little bit more time so that I can document it because one is these big cases are the ones that build the practice. This is what showcases what you do. So
Yeah.
you want to document it. You want to have nice photographs and clean photographs.
Okay. Stop for a moment. Sorry.
Yeah.
You've mentioned a little bit more time. What do you mean by a little bit more? Because I do believe it's much more you need
So I
to
usually
fulfill
will.
this.
Yeah.
Uh,
So it depends on the case. If I'm doing video filming as well, then
mhm,
sometimes I'll book like an hour more. But if it's photographs, my team is pretty good. We can take photographs. I do like 20 to 30 minutes longer.
mhm,
But we're pretty good with taking the pictures now. So
mhm.
we're fast. Like she knows, even my assistants know, like when I do a case, they know when I want to take a photograph. So they'll be like, even if I forget it, I'm working, they're like, hey, did you want to take a photograph? And I'm like, oh yeah, yeah. So they know like the steps and the stages. They already know they're trained how to clean. Like we use retractors, so they know how to hold the retractors.
All right.
So they know their job. So it makes it easier to flow through
Mhm,
it.
mhm, mhm. You've mentioned videography, but you
Yeah.
haven't got any videography on your Instagram. It means you've
No,
started
because
videography, or
so
is it
so the
not a problem?
videography, to be honest, the stuff that we film is more when I teach. So when I teach,
All
we
right.
show the surgeries. It,
All
it's
right.
it's we use right now. I'm just using just for ease of and convenience is a Sony 4K Handycam. It's just mounted on an arm, and we're able to film. It's not artistic, so I don't really put it in there. It shows it's 4K, it's clean, it shows surgery. I don't put it on Instagram because then I have to do edits and make it into short reels
Yes.
and change the dimensions, and I don't have the time for that right
So it's
now.
kind of a
I
pro.
am trying. So this is my next sort of evolution to move into doing reels, which will have a combination of short video clips, photographs, and then maybe me talking and explaining.
You know what I'm asking about the videography because recently I had two attendees on my course,
Mhm.
two surgeons, implant surgeons,
Yeah,
who decided they want to go into the videography, not only
yeah,
photography but videography. Um, and I've discussed the problem with them that it's not that easy as
no,
photography is. It's not
yeah,
easy to have a very clean and nice field of view when you just use a camera. You need to have at least loops for that
yeah,
and a camera which is mounted on the
yeah.
loop, right?
So
Do you use like
So
loops and
there's two
cameras?
problems. So one is the loop
Uh,
camera. If we use it, it moves a lot. It shakes. So there's a lot of editing and stuff. So every time you don't realize how much your head moves until you see the video, and you're gonna get nausea because anytime just shaking and moving to grab an instrument, it goes
yeah,
with your head. If you look
yeah,
up, you look down. So we do use it, not as much as I need to because it's not a good camera to film with. It's much nicer to have a fixed camera that doesn't move with you. But then the drawback for that is the angle is very difficult to get. Because especially if you're in the posterior, it's hard to get the angle. Even your head yourself, when you're working, your hands, everything blocks the view. So it is challenging. So I have, whenever we film, I have one assistant who's watching the camera, and she keeps, every time I tell her if I'm in the way, tell me. So every time she's like head, 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 head. I'm like, okay, I heard you. I can't do this without moving. So now she knows if she says head, head three times and I don't respond, that means that
uh,
I'm not gonna move.
oh my.
So it is more challenging than a photographer than a photo, definitely. And that's why we need like a whole hour extra because it takes longer. I have to sometimes I'm in an uncomfortable position doing the procedure because I want the camera to be able to film. So it's much more challenging. I'm hoping they have a better camera coming out. I'm surprised that they're not investing in surgical cameras that
Not at
do a better
all.
job. Yeah,
Not
I
at all.
asked even when I was trying to get a setup for the camera. I went into our local store and the guy had no idea. It's like, oh, no one has ever asked us that. I don't know. I'm like, okay,
But it's actually the same with photography equipment.
yeah,
When you go to a local store which provides the cameras and lenses for photographers, they don't know much about our profession and they don't
yeah,
know what are our needs. And there are some sets ready for dentists which are, for example, not very appropriate
yeah,
to be purchased. I've noticed quite a lot of that kind of situations online,
yeah,
where if someone just buy it, won't use it at all because that, for example, the lens has the close focus distance of
yeah,
like 40 centimeters, because it's more for like a portrait lens, not
yeah,
for macro. It just has, as they call it, the macro properties, but it's
yeah,
not 100% macro. And this is what happens all the time. So I do feel also that teaching people how to guide them
yeah.
to get the proper equipment is also kind of important, right?
Yeah, so this is where the dental photography courses come in handy because these are people who've spent the time, they've worked
Mhm.
out all the issues and problems, and then they tell you what setup to buy, they explain everything to you, and they make it easy for you.
Nahid,
Yeah.
so tell me, is photograph do your photography has anything to do with becoming a key opinion leader for brands like what is major implant brands like Straumann, right? Straumann and
Yeah.
Nobel Biocare, yeah?
Oh, you know what, Christoph, just give me a second. Can you give me like
All
two
right,
minutes? They've just come
all
to
right.
get the car. Okay, give me one
Well,
second. I'll
we
be right
will wait
back.
for you, no problem.
Okay. Sorry about
All
that.
right.
See, today everything is
Okay.
happening when I have a podcast. Okay.
Yeah, sure. After the break. So again, just to remind you the question,
Yeah.
what does it take to become a key opinion leader for major implant brands like
So
Nobel Biocare, Straumann?
okay, so to your question, definitely photography has had an impact because remember they choose a key opinion leader based on their work and what they can do and how good their work is. And they can't see that unless you photograph it. So photography is like a medium for them to see your work. Unless they're standing there in the operating room with you, they have no idea. So photography has definitely been the way I've grown my practice, the way I've built my brand, and the way other people can see my work and then know that, okay, the work is pretty good. Maybe let's have this guy, do some of our speaking for us. Yeah. So this, like I said, this was one of the, I guess it's marketing material in the end, right? It markets you, it markets your brand. So without a photograph, there's no proof that you can do what you say you do. There's no other way, like, how are they going to see your work unless you photograph it?
Yeah, one photograph being more than 1,000 words.
Yeah.
So you've mentioned your next goal is to do more videography. Other
Yeah.
professional goals for next 10 years?
Uh, so I mean, there's always most of them are related to I stick to dentistry because that's what I know. Uh, I am looking to, so some of the work we do is, so I want to learn more videography. Uh, not really like I want to have a easy, simple setup for our surgeries, but then I want to learn a little bit of video editing and stuff because I find, when someone else does certain things, it's never as good or it doesn't have the same vision that you have in your head. Just like
Mhm.
photography, I mentioned that, I get my assistant to take it and I'm like, no, no, you missed it. You didn't get what I wanted. So I find for certain things, if I can learn the skill, I can do it and I can make it the way I want. So that's one thing. Uh, I want to also change some of like with the practice. I want to change the way we receive our patients. Like right now, it's directly from the dentist, but I would like to transform. Like I've recently hired a prosthodontist, so we want to now market directly to the public. So we're not solely relying on dentist referrals. We can now have people coming in looking for work directly. So these are like my next like initial goals and how to get. And then so how we get there and grow the business is going to be through videography, photography, and things like
Mhm.
this, because now we can showcase some of the work, we can showcase like before and afters and things like that, and that's basically how we promote and grow.
Wonderful. So Nahid, eventually we are slowly driving into the end of
Yeah.
this conversation. So I had one more final question for you. As I am a lecturer, I work at university, I have a lot of students. Sometimes they ask me for my professional advice, what they should do. So, what's a piece of advice that you can give them to get like to the point where you are in when they, for example,
So
start their journey after they
yeah.
graduate the studies? What they should do when they start today?
Okay, so I would give two pieces of advice. Okay.
Mhm.
One thing I would give, no matter what discipline you are or you want to go into dentistry, is be good and learn your basic foundational skills, because that's like your base. Without a good base, anything that you go from there is weak. So if you are in school where you're learning that, learn that and do it well. Because once you can do that well, you can do anything. Okay, that's number one. Focus on the stuff that you think is like this is the stuff after 10 years you realize this is the important stuff. You won't see it now, but the puzzle and the pieces come together after 10 years. You're like, oh, okay, I get it now. Like I teach a lot of surgery to dentists, and sometimes what happens is, there's so much CE content out there. There's so many courses and stuff. They learn all these things and then their mind gets jumbled. They think it's technique and technique and technique. I'm like, no, if you filter through everything, what's the basic commonality in all these different techniques and procedures? It's the foundation. Like, for example, I'm sure you're aware of Istvan Urban, right? So Istvan Irvin does amazing bone augmentation. It almost makes him look supernatural. But what he does best, and he talks about it, but it doesn't emphasize him. What he does best is the basic foundations of how he designs and releases his flap and secures and fixes his bone. That's the most important thing. If you can do that, no matter what technique you do, you will grow and get good bone. And so people are so focused on the wrong things, like, oh, the material that he uses and how much does he mix autogenous bone with this, but it's the basics that is why he's successful. Because you can put anything there, but if you can't close and suture a flap together, everything's gonna fail. So learn your basics, get good at your foundational skills. And then the second thing I would say is we live in a digital age. Not to So if you want to be successful as a dentist, learn how to connect digitally. And that means grow an Instagram profile, grow social media, take photographs, learn how to take good photographs. If you can even have a microscope and film some stuff, if you're in, cosmetic dentistry, things like that. Build through that, because as you do it, maybe right now your work is not so good, but you're building the skills of filming and taking photographs. And then once your work really kicks in and you can do beautiful work, you can also capture it beautifully. And if you can do good work and capture beautifully, you're going to be successful.
Those are really, really wonderful, wonderful pieces of advice. I only regret that we haven't had this conversation earlier,
Yeah.
but but I'm really glad that it happened. So thank you very much for this lovely conversation, for your knowledge, for sharing your experience to what you do, to your passion. I mean, I've learned a lot, and I do think that a lot of our audience will also take away quite a lot, and they will also think over what they do, and maybe they will like start something new which will help to grow their careers, which this podcast is all about. So thank you again for joining me.
Yeah, you're welcome. Thank you for having me.
That was really really pleasure. And to everyone watching or listening, thank you for being with us. If you found this conversation valuable, please share it with another dental professional and subscribe to the channel. See you in the next episode. Take care and bye for now.